I think the biggest change that we're going to see in dermatology is that we're going to have more space. The day we moved into the space we're in now, the day after we moved into that space, it was already too small. I think this will allow us to grow, add more staff, add more residents. So it will also allow us to be more efficient, quite frankly, and see more patients, do more procedures, and actually give better patient care overall just by adding the space. We're going to almost double the size of our clinical space in dermatology in the new building. A lot of what we've designed into that space are procedure rooms. About 60% of what we do in northern New England, cloudy northern New England, is skin cancer. And a lot of folks need skin cancer surgery. So we do a lot of procedures. We remove a lot of skin cancer in the outpatient clinical setting, so we don't go to the main operating room. We do this as an outpatient, so it's very convenient for our patients, but it does require a special setup, a little more space than a regular exam room, and a little bit different type of equipment. So we've designed this space in mind with the coming of the baby boomers and, quite frankly, more skin cancer. There's just going to be a higher demand for our services, especially related to the procedures. This new space, the way we've designed it, putting more emphasis on the procedures, is going to help us better take care of those skin cancer patients. Practice is changing. We're using more physicians' assistants and nurse practitioners. The buildings here weren't necessarily designed for that kind of grouped, paired practice. We call it a pod. Our pod system is going to function much better in the new space. And again, that's going to help patients overall have a much better experience, and it's going to help we physicians to be more efficient in the clinic and hopefully do more, but also better work as well. I think if I were a dermatology patient, I would really be excited about the parking. Number one complaint we get from patients is fighting with the parking garage or parking long distances, etc. This new space, this new building is going to have a parking lot where you park right by the door. You can walk right in. We should have plenty of parking for the volume of patients we're seeing in that area. The overall design of the new facility, I think, is going to be a little bit more pleasing to the patient and quite frankly, a little less intimidating. A lot of our patients walk into this place and feel a little bit overwhelmed just trying to find the clinic. This is going to be a smaller building, much easier to find where you need to go. You won't need a map to get to our offices. So I think in general, just the scale of it, the small scale, will be helpful. This is going to allow us to do higher volume types of clinical trials, have more space to do clinical trials, and probably expand that program as well. We've done very well in our space here in, let's say, the old building, but in the new building, just the volume of space we have will allow us to expand our training program, the number of physicians we have, but also the number of research studies we're doing as well.